Did you know the federal government may already have a file on you, your health records, your bank account details, your benefit history, and you were never asked for permission? That's not a conspiracy theory, my friend. That is happening right now, in databases most Americans have never heard of. If you receive Social Security, Medicare, or food assistance, there's a very real chance your personal information has already been collected, cross-referenced, and shared between multiple government agencies. Stay with me, because what I'm about to share affects millions of seniors across this country, and you absolutely deserve to know the truth. If this matters to you, hit that like button, subscribe so you never miss these important updates, and drop a comment below telling me whether you knew any of this was going on. Now, before we get into all the details, I want you to take a slow breath, because this is the kind of topic that can feel overwhelming at first. But I promise you, by the end of this video, you're going to walk away feeling informed, empowered, and a whole lot less in the dark. Because knowledge is power, and nobody should be left wondering what the government knows about them. Let's start at the very beginning, with something that caught a lot of people off guard when it quietly rolled out. The Department of Homeland Security, yes, the same agency that handles border security and immigration, has built what experts are calling a national citizenship database. Now, you might be thinking, well, I'm a citizen, so why does that concern me? Here's the thing, this database was created by merging records from the Social Security Administration with data from various immigration agencies. That means your name, your Social Security number, your citizenship status, all of it has been pooled into one searchable system. And millions of Americans, both US-born citizens and legal residents, ended up in it without ever being directly asked for their consent. The official reason given for this database is what's called the SAVE program, that stands for Systematic Alien Verification for Entitlements. The idea is to verify whether someone applying for public benefits is actually eligible to receive them. It's also being used to help state election officials maintain accurate voter rolls. On the surface, that might sound reasonable. Fraud prevention, making sure the right people get the right benefits, most of us would agree that's a worthy goal. But here's where it starts to get a little more complicated, and where many seniors are starting to ask some very fair questions. Think about it this way. Imagine you've been receiving Social Security benefits for years. You paid into that system your entire working life. You followed every rule, filed every form, showed up every time you were asked. And now, without a letter in the mail, without a phone call, without so much as a knock on the door, your information has been folded into a massive government database that connects your identity to your benefits, your immigration status, and possibly much more. For a lot of people, especially those who grew up in an era when privacy was taken seriously, that feels like a significant shift. And they're not wrong to feel that way. Now let's talk about something that was announced just last year, in July of 2025, that flew largely under the radar for most people. The Centers for Medicare and Medicaid Services, which we usually just call CMS, unveiled a new health data tracking system. This one pulls health records directly from major technology companies and medical providers. We're talking about a system designed to create what officials described as a fuller picture of a patient's health. The idea is that if your doctor in Florida can instantly see the records from your cardiologist in Ohio, that could genuinely save your life in an emergency. And honestly, there's real merit in that vision. Right now, this health data system is opt-in, meaning you have to choose to participate before your records are shared. But here's the question a lot of healthcare advocates are already raising. How long does opt-in stay opt-in? How many seniors will even know they have a choice? And once your health records are flowing through a system that connects to tech companies, what safeguards are truly in place to keep that information private? These are not paranoid questions. These are exactly the kinds of questions that careful, thoughtful citizens should be asking. And speaking of questions worth asking, let's talk about what's happening with your food benefits and how your grocery choices may be more tracked than you ever realized. At least 27 states have now shared sensitive data about SNAP recipients, that's the food stamp program, directly with the U.S. Department of Agriculture. The stated purpose is to catch duplicate payments and to remove deceased individuals who are still enrolled in the system. Again, on the surface, that's a legitimate administrative goal. Waste and fraud in government programs cost taxpayers real money, and most of us want those programs to be run efficiently. But when you realize that sensitive personal data about people who rely on food assistance is being handed off across state lines to federal agencies, it raises real concerns about just how wide that data net is being cast. And then there's the Social Security Administration itself, which has recently begun sharing personal data with the Department of Homeland Security to assist with immigration and visa enforcement. Now, for most seniors who were born here, lived here, and worked here their whole lives, that might sound like it has nothing to do with you. But remember, when agencies start sharing data with each other, the categories of who gets caught up in that data tend to expand over time. What starts as targeted information sharing has a way of becoming something much broader. This brings us to perhaps the most ambitious, and the most controversial, of all these initiatives. There's a push, largely driven by what's been called the Department of Government Efficiency, or DOGE, to merge personal data from the IRS, the Social Security Administration, and Medicare into what some officials have described as integrated personal profiles. Now, take a moment and really think about what that means. We're talking about a single file that could contain your tax information, your Social Security benefits, your Medicare claims, your disability status, your student debt, and, according to some reports, even your bank account numbers. All of it, stitched together into one comprehensive picture of your financial and medical life. Now, supporters of this kind of data consolidation argue that it makes government more efficient, reduces duplication, and helps identify people who are gaming the system. And look, nobody wants fraud. But there's a very important conversation happening right now among privacy experts, senators, and civil liberties organizations about where the line is between legitimate oversight and something that starts to feel uncomfortably close to surveillance. And that conversation affects every single person watching this video today. Here's what I want you to take away from all of this, because I know it's a lot to process. You are not powerless in this situation. Knowing that these databases exist is the first and most important step. In the next part of this video, I'm going to walk you through what your rights are, what questions you can ask, and what steps, simple, practical steps, you can take to understand what information is out there about you and how it's being used. Because you worked too hard and lived too long to be left out of a conversation that is very much about your life. So stay with me, because we're just getting to the part where things get really useful, and I think you're going to want to hear every word of it.